let's start with some brief introductions. Catherine, do
Yeah.
you want to go first?
Sure. So, Katherine Byers, I'm the Government Relations Officer at the Houston Food Bank. I've been here for about 5 years, and our department handles all the relationships with elected officials. We do policy work, advocacy, civic engagement. We're a small but mighty team, and even though the food bank's focus is food insecurity, we are really concentrating on the drivers of food insecurity, so housing, health, and economic stability. So, people in good paying jobs, paid time off, childcare, things of that nature.
Amazing. I'm Jill Valente. I've been with All In Together for about 2.5 years. I'm the Director of Operations and Events.
I'm Priya Langevin. I'm All Together's Director of Programs and Research. God, I feel like I don't even know how long I've been with AIT anymore at this point. My whole life, it feels like sometimes.
Just your whole
A
But
good
life.
thing. A good thing.
yeah, but we've had the pleasure of partnering with the Houston Food Bank for our community work for almost 3, 4 years now.
I think the events that we've done bring folks together in community to really learn about civic engagement, talking to their elected officials, which makes it less scary, I
Yeah,
think, because a lot of people hear policy or advocacy and are like, that's not for me.
100%. Discuss this a lot as a team, like trying to kind of almost take those words out of it and just understand that these relationships with the elected officials or anyone in local government just are so powerful, and you can truly make an impact when you kind of lean into them. We would love to focus, obviously, we wanted to have you because what's happening to food banks right now, I personally don't feel like the media is giving it enough attention, because it's just going to change so many lives for
Yeah.
the worse. And when we have calls with you, Catherine, and you explain exactly what's happening, I think that's something that needs to be shared a million times over. So give us a little snapshot, I guess, of what has happened this year.
Sure. I guess I should start by saying that food banks are really efficient at distributing food to the community. The Houston Food Bank covers an 18 county area, and we serve about 1 million food insecure folks. While we're focused on emergency food distribution, we are only supplementing people's plates.
Yeah, and I don't want to interrupt you too much, but we've been to the food bank, so I got to see just the massive operation
Yeah,
that it is. But can you explain exactly what that means? Like, does a family show up once a week and get X, Y, and Z? How
sure.
does that work?
Yeah, so we actually operate through 1,600 partners. So we do very little direct food distribution to our neighbors. That's how we refer to folks with lived or living experience with food insecurity. We do have a curbside program here, but other than that, we work with communities of faith, schools, nonprofit organizations, and they are the ones we deliver the food to their sites, and then they are the ones who distribute it to our neighbors. So here we have about a 300,000 square foot facility. A chunk of that is warehouse, but we also have a 10,000 square foot kitchen because we prepare meals for seniors, for after school programs, as well as for our summer feeding program.
Okay, and you serve about 1 million people, you said.
Yeah, we serve about 1 million people. We know that there are about 1 million food insecure individuals in our service area. So we're trying to reach all of them through our partners. And our partners have different dates and times when they're open. We recently entered into agreements with them to serve at least 4 times a month because we want to make sure that there's equitable access. So somebody who's working during the day on Wednesday could go on a Saturday, or
Mm.
somebody who's working at night or the weekends can go during the week.
I always get emotional when we talk about this because, I'm a mother of three, and a lot it's hard to imagine. It's hard to imagine, and it's just the work you do is so important. So what has happened this year?
So, where to begin? The first thing that happened is that there were food orders that were canceled. And when I say food orders, I mean $25 million worth of food. And that was just for the Houston Food Bank. So imagine those big tractor trailers That's 500 tractor trailer loads of food. That is a significant cut. USDA Foods, the United States Department of Agriculture, accounts for about 23% of what we distribute. And so that's a significant amount that we were anticipating. Another program that was cut is specifically for local farmers. And so we're able to take that funding, build their capacity to serve their community, to build their economic well-being, and then to also receive product from them so we can then distribute it to the community. The third round of that program was eliminated. And so all in total, in terms of the revenue we were expecting, it was about a cut of $11 million. So just from those changes, we have had to do a 15% reduction in staff and also obviously change our funding and procurement goals. And, food banks really rely on surplus. So retailers who who either have surplus or have a dented can or a bent carrot that for some reason the public won't buy because they think, well, that's not good or not nutritious. We have a state grant where we get that kind of produce, the bent carrot, which is called second grade. We rely on folks, just your average community person having surplus. The Houston Food Bank only purchases about 3% of its food because we want that funding to go back into our programs to help folks not have to get into our lines. So it puts us at a significant disadvantage. We will continue to serve the community, but there will be less pounds and less variety.
Can we talk a little bit about that last bit that you just said about trying to make sure people don't get into the lines at the food bank in the first place? 'Cause I know one
Yeah.
of the things that you do is work a lot with the Food Bank's Advocacy Council, and these are just regular folks who've been part of the programs there. Talk a little bit more about that and like how some of these folks get involved.
Yeah, our vision is a world that doesn't need food banks. So we don't want to be setting folks up to walk through a revolving door and to always have to rely on our food or to rely on public assistance. The majority of folks who seek our services who are on SNAP and Medicaid work. They just may not be able to get enough hours.
I know you should say that like again and
Yeah.
loud.
Yep, the majority
Maybe
of
slower and louder.
participants, yes, on SNAP and Medicaid work.
Yeah.
They work. The overwhelming majority. And the overwhelming majority of SNAP recipients are children, seniors. So when we're talking about folks who aren't working enough hours to meet the work requirement, which is 80 hours a month, working, being in a job training program, we're talking about folks who work contract, who work hourly and can't get enough hours. We actually had a husband and father of 3, I think 6 months old, 7 years, and 9 years old, come to the food bank to sign up for SNAP. He is begging his employer, he's a security guard, for more hours. He can't get them. And so he's under the work requirement. He's trying to apply for SNAP. These work we'll get into that, but to answer Priya's question, we're so happy. This is the second year of an advocacy council that we've helped put together. It's comprised of neighbors as well as some of our food distribution partners, and they are really helping guide our advocacy work. They have learned about policy, civic engagement, and more importantly, they have learned they have a voice. Every person out there has power. They just need to step into it. Elected officials don't have more power than you do. Your voice, all of our voices together, can create a tsunami. And elected officials are responsible for so much. They really do need to hear from their constituents. So our advocacy council, lived experience, frontline experience, has really been trying. They met with some elected officials in DC. They met with their state officials during the legislative session, and they're just on fire. Even meetings that didn't go particularly well, they didn't get the yes, they realize how much power they have sitting in that room and informing that elected official. And that kind of work, that ripple effect, is so important right now based on a piece of legislation that's currently sitting in the Senate, US Senate, and will be voted on soon. So that, I don't know, segue into talking about that. Folks
Yeah.
may have heard about this in the media. It's called the One Big Beautiful Bill Act.
Oh, I've never heard of that.
Yes, yes. I mean, barely in the media at all. And essentially, there are lots of components in this bill, including tax cuts, other things. What we are most concerned about is an expansion of SNAP work requirements. Let me say first that we agree with the Trump administration that food security is about national security. The administration has said that.
Okay.
And food insecurity has actually increased in this country and in this state, Texas, as well as the county, Harris County, that we're in. I think this point, the third largest county in the country. We also agree that folks who can work should work, and they want to work, and as I said, are working. So the expansion of these requirements are to parents with children 7 years of age and older, as well as older adults from the age of 55 to 64. So let me give you an example. Grandmother isn't working. She has either retired or can't work, but is providing childcare for her daughter, taking care of her grandparent. If the work requirements expand to her, she now has to go to work, can't provide for her granddaughter, and essentially will not have access unless she gets those hours at work, won't have access if she's new to Medicaid, and won't have access to SNAP. What possible good can that do? So I think there's more alignment between the two parties than they realize. It's just some misperceptions about who this bill impacts. The other piece I'll quickly talk about is that right now, states do not pay anything towards SNAP benefits. That's 100% covered by the federal government.
Okay.
There are also administrative costs, right? With anything to administer a program, there are costs associated. Right now, states pay 50%. The federal government is increasing that to 75%, so upping it by 25%. And states will now have to pay, and there's a range. We think Texas will be paying about 15% of the food cost, but it can range from 5 to 25. So that is going to shift. I think in Texas, we're talking about 1.2 billion with a B dollars a year. So even if our legislature is willing to allocate that funding, where are they going to get it from without cutting to other programs? I know I'm not the bearer of like great news. I will say that the bill in the House that passed the U.S. House would have been worse if it wasn't for advocacy. So it's not that advocacy doesn't work. It's that we don't have enough people engaged in it. We need people. The Senate vote will take place around July 1st, maybe 2nd. So people have a short period of time to call their senators and say, no, this is going to have, we're talking about, I think 11 million people are going to not have access to Medicaid. While Texas isn't a Medicaid expansion state, we have folks who, that's a lot of that population. We're also going to have folks who the only way they can afford the Affordable Care Act, what's called the exchange, is through a subsidy. Those subsidies will end at the end of this year in this legislation. I was actually had to make use of the exchange before I got this job, and that subsidy made it possible for me to provide health care for my husband who had some illnesses and my son.
Yeah.
So that's the only insurance that folks in that position qualify for. So, and can afford. So we're talking about basic needs, not boats, not, right? Like healthcare and food, nutritious food.
Yeah. All right. So there is still time to make this change. So this is kind of where blend together, and like Priya can kind of explain, like these phone calls to your senators can make a difference. And if we have, let's say, just under a month, I mean, that's a lot of time. that's a lot of calls, and
Mhm.
that's
Yeah.
a lot of people that can
Like a
get
call or an
involved.
email hardly
Yeah.
takes any time at all. You don't
Mhm.
need to be an expert. You
Yeah.
can literally say, "Don't cut SNAP or Medicaid." Protect it, and that's it. And research has shown that when an elected official gets about, I don't know, 10 calls or so, or 10 contacts on an issue, they start to perk up because these are their constituents, the folks who vote for them to keep their
Mhm.
jobs.
Yeah.
So yeah, they
Yeah.
start
And
to
it's
listen.
our
You
role
know,
as constituents to hold them accountable. Like, bring them
Yes.
in.
yeah.
And it's a really kind of a partnership that maybe, isn't so
Yeah, and I think we talked about this too on one of the sessions Lauren did last week or 2 weeks ago about just like put that little bit of extra effort into personalizing that message because there's so many scripts out there. I'm sure you can
Yes.
Google one, find one, and there's apps, there's like 5 calls and some of these different organizations. But after a while, when they start to feel a little bit like repetitive,
Yep.
I think people start to ignore it. So I think
I
if you
agree.
just take those like 5 minutes to like personalize that script a little, change the email subject line, and that's what's going to get people's attention, right? And there's numbers, you can look for numbers, you can look for stats, but I think we've talked about this and kind of goes back to what you were saying, Catherine, about the advocacy council, that telling your personal story makes a much bigger difference here, even than just like the numbers and the stats sometimes, because that's the emotional piece is what moves people.
Absolutely. And I there is unfortunately a lot of shame associated with not having enough to eat, with not being able to put food on the table for your children. I have a 6-year old. I can't imagine not being able to feed him. But we have all had struggles, and we are all we've all been in a situation where we needed support and help.
Mhm.
And I have run into so many people who we're starting a conversation in a completely different direction. And when they hear where I work, they'll say, you know what, when I was a kid, my mom we didn't have enough to eat. And I'm like, that's the story,
Yep.
right? That's the
Mhm.
story that we need you to tell, is that I know how important it is. My mom was working, my mom was going to school.